Congresswoman
Hi
Kate.
there.
My name is Julie Miller, and I'm a graduate student at University of Texas at Arlington. And we're taking I'm taking a healthcare policy and politics class.
Okay.
And so I appreciate you taking a couple of minutes out of your day to just discuss a policy that I'm very passionate about. And
Sure.
it's the Senate Bill 339 that was passed in June of 2015. Are you familiar with that one?
I am. I think I remember that one.
Yeah, so it's we legalized the medicinal use of cannabis for patients with intractable epilepsy. And I've read a lot of reviews about this bill, and it seems like, some critics are saying that it's unworkable because of a couple of reasons. One is the requirement of physicians to prescribe the medication, which puts them at risk for, federal mandates or federal regulations against the prescription of cannabis.
Sure.
And then another issue is just with the very small amount of THC that's in the oil, because some of the evidence points that there's better control for epilepsy if there is a little bit more THC in the oil. And then the third issue that I have or I wanted to talk to you about, is just the opportunity to open the requirement up to more patients. So the veterans that have post-traumatic stress disorder, there's a lot of evidence that shows that this treatment is very effective for their anxiety and depression. And I was just wondering if you could give me some of your feedback or your position on the statement or on the bill.
I think I remember that one. First of its kind. It was a tough one.
Yes, yeah.
And tough one to get through, and a lot of education that went with it, to help people understand. I think that many other states have certainly pioneered the way, and it's something to consider how we can expand it, and how we can get it accessible to those people that really do need it.
Yeah, so the bill was passed a year and a half ago, and so we still haven't licensed any dispensaries to actually get it out to the patients. And I didn't know if you had any feedback on the steps that it takes to license the dispensaries, or where we're at now with getting them licensed.
Well, I think that we definitely need to get organized about it, and create a task force to really look at how the other states, what they've learned, on that process, and both the nonprofit, making sure they're nonprofit organizations as well.
Yeah.
So we just want to make sure we get it in, controlled and in the right way.
Well, great. Well, thank you for your time, Congressman Kate.
You're welcome. Anytime.
Okay. Bye bye.